So moving on to case number 4, this is an asymptomatic screening mammogram. And so just to pause for a moment and look at these images from the screening mammogram. So just on the 2D images alone, we can see that this patient has a really fairly complex breast pattern. She has a biopsy clip in the right breast. She has postoperative findings in both breasts, as you can see depicted by those linear radiopaque scar markers. Her power look density assessment was a C, so the ICAD also agreeing that this is a heterogeneously dense breast patient. So if we go to the next slide. So what I wanted, I'll show you why I really wanted to highlight this case. And I think this case really illustrates sort of the satisfaction of search element to what we do in radiology, especially for a patient with dense breast tissue and a lot of complexity to their breast from previous scars and biopsy markers. So what we're showing on this particular slides, we have the 2D screening mammogram on the left. There's nothing suspicious or focal on that left CC 2D view. The middle view with the blue arrow is showing us a very subtle architectural distortion that you're starting to see kind of at the back end of the fibroglandular tissue central to the nipple on that tomosynthesis view. And then on the image on the right is showing that the profound AI had detected that distortion and certainly made it much more conspicuous for the radiologist. So moving on to that same case with the MLO views. So I want to in particular point out the scar marker on this MLO view. So this is one of those cases and just a good example of how you can imagine if you're going quickly through cases and you see that on the 2D image, that scar marker is almost directly overlying that area of suspicious architectural distortion. So that's what we're showing here on that middle image is that architectural distortion where you can see pointed to by that blue arrow. And then that architectural distortion in the right-hand image that is made much more conspicuous by the detection of profound AI. So I wanted to show this slide just to kind of give you a context of where the scar marker was with relation to that suspicious architectural distortion. And then if we look at that a little bit further, going on to the next slide. So what I am showing on this one, just I know it's a little bit of a busy slide, but just to kind of orient you. So the very far left image is showing us that suspicious architectural distortion on the ML view, and then I put the localizer bar adjacent to it for that left-hand image. So as we can see on that localizer bar, that suspicious distortion is localizing to the central aspect of the breast. And again, with that profound AI detection being shown in the middle view, just to show how that profound AI had shown the extent of that architectural distortion. And then on the right-hand view, again with the localizer bar, so here again we see that radiopaque linear scar marker, the localizer bar just showing us that that scar is way on the lateral aspect of the breast. So this is a case where you could be confused by that scar marker, which on the 2D views is almost immediately overlying that architectural distortion. However, with the benefit of the AI detection and the localizer bar, we can see that it's actually two distinct findings. So as we go to the next slide, a targeted ultrasound was performed for that architectural distortion central to the nipple. We can see here a subtle irregular hypoechoic mass at the 6 o'clock position close to the nipple that did correspond with that architectural distortion seen on the screening. So this patient also did go on to have a biopsy, and what we're showing on the next image here. We can see biopsy clip, which corresponds to the architectural distortion. This was another case of an invasive lobular carcinoma. So similar to the case prior where we had shown these fairly sneaky, subtle to detect, notoriously difficult invasive lobular subtype carcinomas. So this case, as I've mentioned, really highlights the benefit of profound AI for interpreting tomo with dense tissue. This finding, interestingly, had actually been recalled the year prior. It was much smaller and more subtle the year prior, and it had in fact been passed as benign scar tissue. And we've shown kind of exactly how that could happen, especially if you're going quickly through your diagnostic day. I think this case is also a great example of how profound AI helps with that satisfaction of search element that certainly contributes to radiologist error as they're going through a busy day and seeing a lot of cases. And I think I also like to think of the profound AI, and this is a good illustration of that, encouraging a pause for the radiologist. So when you have complex breast tissue, multiple findings identified in a single breast, it's really important, and I've really incorporated this into my practice, really initiating that pause to make sure that I'm really looking carefully at anything that the profound AI is detecting for me.